Hey everyone, it's Steven Lome, lifestyle medicine cardiologist. In this video, we are going to talk about 3 things that can predict pretty much all of your risk of having a heart attack, clogging your arteries, and having a stroke. Let's get into it. You need to know these 3 things, where you stand with them, and how you can reduce them down to normal levels if possible so that you don't die from America's #1 killer, heart disease. But before we get going, don't forget to subscribe to my channel, like this video, give me a comment, and let me know what you've done to help control these 3 risk factors. The first one we've talked about before is the LDL cholesterol. It's so critical. Researchers say that the prerequisite to clog your arteries up with plaque is having an elevated LDL cholesterol. So if you can keep your LDL under 70, the chance of you actually clogging your arteries and having a heart attack extraordinarily low. Check out this study in the Journal of the American College of Cardiology. The average American has an LDL cholesterol of 125. At that level, you end up having a significant risk of heart attack by the age of 40, even higher by the age of 60, and by the age of 80, a pretty darn high risk of having a heart attack. Now, what about somebody who has a LDL cholesterol of 60? By the age of 40, very low risk, less than 1%. By the age of 60, less than 1%. And by the age of 80, still less than 1%. The sooner in life you get your LDL cholesterol down, the better you're going to be. Now, what about an LDL of 160? Wow, the risk is off the charts by the age of 40, by the age of 60, and then by the age of 80, it's very likely that a heart attack could happen. Check out my video on lifestyle medicine and heart disease. It's comprehensive in regards to what you can do to lower your LDL cholesterol through diet and a little bit through exercise as well. The second thing that increases your cardiovascular risk is the C-reactive protein, and that is a marker of inflammation. The higher your C-reactive protein, the more inflammation you have, the more likely it is that you're going to clog your arteries up with plaque. Well, why is that? Well, there's really 2 things you need to develop plaque buildup and clog your arteries. One is the LDL cholesterol being elevated, like we just talked about. And the second is damage to the endothelium, the lining of the arteries. If there's high blood cholesterol circulating in your system and then you damage your arteries slowly over time, the plaque builds up and you can develop a clogged artery, which can then, if it becomes inflamed, trigger a heart attack. We don't want that, of course. So you want to get your C-reactive protein down. Well, how can you do that? Well, predominantly it's through diet. We know that getting rid of all processed foods, minimizing animal foods, and focusing on a more plant-based diet is the best way to reduce inflammation and reduce your C-reactive protein. This study done by Walter Willett of Harvard really showed which foods increase inflammation and which ones are anti-inflammatory. But a lot of people say, well, what about things like chicken and eggs and fish? Those aren't good for heart health, right? Well, there was actually a big study that was done which took people after having heart attacks and they randomized them to the American Heart Association diet, which included chicken and fish, a little bit of eggs, and the healthier types of oils. But it was still a very healthy diet, no processed foods and a lot of plant-based foods in it. They compared those people to those that went on a complete 100% vegan, whole food, plant-based diet, unprocessed. And what did they measure? C-reactive protein. Guess what they found? Those who went on the complete plant-based diet had a markedly lower C-reactive protein compared to those on the standard American Heart Association diet, whose C-reactive protein still remained significantly elevated. So the best way to lower your C-reactive protein and lower your heart risk is a plant-based diet. Check out some of my other videos about how to do a plant-based diet the right way so you can learn more about how powerful this can be for overall cardiovascular risk. Now, the third thing that can predict your risk of clogging your arteries and having a heart attack is lipoprotein little a. Lipoprotein little a, or LP little a, is actually a genetic subtype of LDL cholesterol. So it kind of has some of the similar concepts to the LDL cholesterol, that if it circulates in your blood over time, it can clog up your arteries if the endothelium is injured. So what can you do about the lipoprotein little a? Well, this is considered highly genetic, and a lot of people are like, there's nothing you can do about it. Is that really true? They're working a lot on this, and there's been a pretty decent amount of research because somewhere around 20 to 30% of people have a high lipoprotein little a. We do know that diet and lifestyle can impact this. Dr. Baxter Montgomery in Texas, he did a good study where he put people on a complete plant-based diet and measured their lipoprotein(a) before and after, and they saw a pretty significant 15% reduction. Is that enough really to lower your cardiovascular risk? Because some people's lipoprotein(a) are super high and 15% isn't going to do much for you. They did similar studies with niacin. Niacin lowers it, but just not enough. And other studies with medications such as PCSK9 inhibitors, Repatha, Praluent, and inclisiran, they lowered it, but general, maybe 20 to 30%, not really enough to have a big impact. Researchers, of course, are trying to find lots of new medications that can lower the lipoprotein(a) and lower your risk. But really, the most important thing to do is to control everything that you can control if your lipoprotein(a) is high. If it's high, you're at a higher risk of clogging your arteries and heart disease. So make sure that you get your LDL cholesterol down, your C-reactive protein down, don't smoke cigarettes, exercise, maintain a healthy weight, eat as plant-based as you possibly can. We know that genetics is not the only important thing in regards to cardiovascular risk. Well more than 90% of heart disease is preventable through lifestyle changes. Therefore, that means you're the one who has the most power over your cardiovascular risk. This study, taking the highest genetic risk individual, showed that strict lifestyle changes can dramatically lower the risk of having a cardiovascular event like a heart attack. They always say the genes might load the gun, but the diet and lifestyle pulls the trigger. A very recent publication, just September 2025, showed that 99%, almost 100% of people who had a cardiovascular event had at least one risk factor for heart disease. And so if you can just make sure you don't have any risk factors, you can nearly guarantee yourself not having a heart attack or a stroke from a clogged artery. Lifestyle is powerful. Well, I hope you like this video and you know your 3 things that can significantly increase your cardiovascular risk. Make sure you know your LDL cholesterol and your C-reactive protein. Measure your lipoprotein(a), and if it's high, that makes it even more important for you to do all those proper lifestyle changes in order to keep yourself healthy and make sure you don't have a heart attack. Give me a comment below about the things that you have found that have lowered your risk factors, and don't forget to subscribe to the channel, turn on notifications, like this video, share it with everybody, and I'll see you next time.